this is likely some sort of genetic setup. And I'd love to get answers. I didn't know it was going to take 10 years, to get answers.
Yeah.
But started by looking in the eyes, because that's where I was comfortable. And I remember telling people when the doctors said, your blood work looks fine, everything looks good. I said, there is no possible way everything could look good and you're this sick. So we're not looking in the right places. Where else can we look? Yeah. Well, let's look in the eyes. Nobody's done that. And that started that journey of very gradually getting answers.
Welcome to The Functional Edge. I'm Dr. Julia Ward, and this is where science meets real-world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. All right. Hello, and welcome to the Functional Edge podcast. I'm your host, Dr. Julia Ward, medical director and founder of Balanced Body Functional Medicine. Today, we're honored to welcome Dr. Diana Driscoll to our show. With a background in optometry and advanced research into the autonomic nervous system, she brings a unique and innovative perspective to complex chronic conditions like POTS, connective tissue disorder, and chronic inflammation. Her work has helped uncover the connection between intracranial pressure, vagus nerve function, vascular health, and the aging process, areas that are often overlooked but deeply impactful to overall health and cognitive performance. In this episode, Dr. Driscoll will be sharing insights on inflammaging, autonomic nervous system dysfunction, and strategies to support long-term brain health and resilience, offering expert guidance to help you navigate your health journey with the latest advancements in functional medicine. So stay tuned for an engaging conversation that promises to empower and inspire your path to wellness. Welcome. Thank you so much for being here.
Thank you, Dr. Ward. It's an honor to be here. I'm excited to talk.
Awesome. Well, first, I want to just briefly have you tell us a little bit about your story and how you got into this research, because I think that's a pretty amazing story.
Well, you're very kind. I went into this kicking and screaming. Actually, I had many plans to do this. I'm an optometrist and had multiple offices, enjoyed my work. And then I got sick and got thrown into POTS, postural orthostatic tachycardia syndrome, or a failure of the autonomic nervous system, the part of the nervous system that you're not supposed to have to fiddle with it. It works all by itself, right? And it's work. And no one could help. It was just the strangest journey to me. They were trying to treat it based on controlling the symptoms, which were dramatic. And my approach was, but something happened. I got a virus and all this started. So could we figure that out and get back to health rather than just try to control symptoms? And there was no real interest in it.
Yeah. And can you just give us an example of the symptoms that you were dealing with?
Yeah, absolutely. There were so many of them. And very frustratingly, Dr. Ward, they would change over time. So I had a list of symptoms every time I went to a doctor, and I went to 50 doctors. That's no exaggeration, as every system of the body was affected. But whenever I went to a doctor, I'd pull up this list of symptoms on my computer and change them. It's like, chasing a moving target. No wonder they're frustrated. But when it first started, and it was like 2 weeks after getting a virus, and I recovered from the virus itself was gone. My heart started to act up. Like I couldn't control how fast my heart was going. I would change positions, stand up. It would just start racing. My blood pressure would go all over the place, which is just a really weird feeling. But I was dramatically dizzy, sometimes vertigo, where it looked like the ground was moving or you're in a boat. I got nauseous. I got stiff neck. I got real shaky, weak and shaky. I could not breathe. It was sometimes just the worst possible symptom. Sometimes it felt like I couldn't take a full breath, like my lungs were in a can or something, where I could take in some air and then it would just stop. And other times I felt like I was taking in the air, but my brain was not getting any oxygen. I felt like I was suffocating. And then my personality started to be affected. I normally have a pretty easygoing temperament, but it was all over the place. Surges of anxiety, even panic would hit, the waves of depression. And again, I went everywhere for help. The day I got sick, I could not see my last 2 patients that day. It was like, that was it.
Wow. Really dramatic.
Yeah, dramatic. I mean, I'm hunched over. I can't breathe. I'm shaking. There's no possible way I can be an eye doctor, and could not return to work. And then about 2 years later, my son got a series of just regular viruses, ones that all of his friends got. And each one just knocked him down further. And the third one, he was disabled.
Wow.
Sometimes he couldn't even sit up without fainting. His growth stopped. He got sick when he was 8 years old. And by the age of 12, we were charting his growth, no growth. He developed severe osteoporosis. And he broke his arm just throwing a ball, just putting on his coat. But no one was helping us. I could not understand it.
Yeah.
I got thrown into research.
So you started doing the research yourself.
Yes. I set up genetic disease investigators. I thought if we have any chance of figuring this out, I'll go ahead and house it in a corporation. And my daughter eventually got sick too. And I thought, what are the chances that there's no genetic components? If I'm sick, then my kids get sick. And my husband at the time was fine. Mm-hmm. So I thought, okay, it's not something in the house, we're not being poisoned. Yeah. This is likely some sort of genetic setup. And I'd love to get answers. I didn't know it was going to take 10 years, to get answers.
Yeah.
But started by looking in the eyes, because that's where I was comfortable. And I remember telling people when the doctors said, your blood work looks fine, everything looks good. I said, there is no possible way everything could look good and you're this sick. So we're not looking in the right places. Where else can we look? Yeah. Well, let's look in the eyes. Nobody's done that. And that started that journey of very gradually getting answers. Yeah.
That's great. That's great. So a lot of your work focuses on inflammaging. How do you explain that in a way that really clicks for both clinicians and patients?
This has been part of the journey because at first it was all about recovery, right?
Yeah.
Wanted to figure out POTS, which as it turns out, it's not really a disease, right? It's just a presentation. Other things are causing that. You have to figure all that out. But upon recovery from POTS, not being ill anymore, the question comes, is what we learned about chronic inflammation and vascular health, the cardiovascular system is affected, the autonomic nervous system is affected, and how to correct that. Are we not being proactive enough as we get older? Are some of these old age illnesses, the tendency to cardiovascular disease, or the more or less acceptance of, oh, I'm tired because I'm old, or I'm brain foggy because I'm old, that sort of thing.
Yeah.
We ignoring how we can be proactive in this. And if what we learned going through that whole journey with POTS recovery, can that apply to a larger segment of the population? And the term inflammaging is not mine. Someone else put that out there. We know that as we age, levels of inflammation go up. And it has to do with cell senescence, et cetera. But as that inflammation goes up, why aren't we taking care of it? Right? Mm-hmm. If we can control some of that normal tendency, could we retain some of that more youthful energy, brain function, cardiovascular function?
Yeah.
And I am here to do everything possible to never get sick again and to be healthier as I get older. So I do think I'm probably the most active person I know of any age, frankly. Yeah. And some of that's just making up for lost time. And then some of that is because I am so proactive. So I really like to talk about that. What people can do based on what we were able to figure out with POTS is a dramatic illness in most patients.
Yeah.
But take what's happened and turn it down a little and look at a bigger population, if it makes sense.
Yeah. Yeah. So your work connects the autonomic nervous system to inflammation and aging. How does dysfunction in that system actually drive the aging process?
Yes. To some degree, inflammation itself, as it goes up, as we age, cells die, et cetera, we produce, the inflammation itself causes problems with the autonomic nervous system. And this was just such a huge breakthrough. No one had really dug into that before. And even though some of that was in research, It wasn't applied clinically, which is, I think, unfortunate. But certain aspects of inflammation, some chemicals, if you will, that are released by certain inflammatory cells affect the release of the neurotransmitter. And when that's affected, then not only do the parasympathetic nerves, like the vagus nerve that controls digestion, heart rate, breathing, etc., ironically, it also helps us control inflammation. But it also affected the central nervous system, the brain, release of the neurotransmitter for the brain, and for the peripheral nervous systems, muscles, etc. And I was able to prove that by looking at the pupils. I was noticing that patients had more enlarged pupils than the general population, tendency for dry eyes. And the only thing that will change a pupil size when the light is the same is the autonomic nervous system. And when we could change that, get those pupils to normalize, we knew we'd hit the receptors properly. So with the vagus nerve, that was so big because the vagus nerve is the anti-inflammatory nerve. So here we are as people normally aging or sick people where we have a certain level of inflammation, and then we start to lose the neurological control of that inflammatory system, and it starts to cycle. And get caught in that all the time. I know I did. We've got to right the wrong in the neurology. You have a fighting chance to help get on top of that inflammation. Yeah. It is quite the picture.
Yeah. So we often simplify the autonomic nervous system as a fight or flight versus rest and digest.
Yeah.
What do you think we're missing in that model?
I think actually that is a great start. I really do. And I think it's very easy to get that balance out of whack. And then where it was happening to patients, and when I was a patient, was when the sympathetic was in overdrive and you had that fight or flight, the doctors were trying to slow it down. They try to slow down the heart rate or give you sedatives or something to try to take that down.
Yeah.
No one before I came along was looking to support the parasympathetic, and that was going wrong. So getting that balance is really important. But I think at this point, what might be getting missed more often is the central nervous system. And in my case, I got lucky. I don't know if I got luck. So I was sick, right?
Yeah.
And the sticker I got, I went from dramatic insomnia. I could be awake for days, literally. I could not stay awake. And I couldn't think. I couldn't make a to-do list, of 2 things. I just couldn't do it. And the times I could make a to-do list of like 2 things, I was literally on the floor asleep for 7 hours. That was just mentally exhausting. And I told the neurologist, I feel like I'm running out of something. I'm awake maybe an hour and a half in the morning, an hour and a half at night, and I'm struggling even with those 2 time periods, and they're getting shorter. And so what's going to happen? Do we just stop waking up?
Yeah. He's just going to be a permanent sloth.
Permanent, yes.
Yeah.
And he was thinking it was some sort of neurodegenerative condition, but he couldn't quite figure out a label.
Yeah.
No, it was the neurotransmitter. And when I went back with the over-the-counter thing, I could immediately stay awake. I could think. I remember that first day, I could stay awake for like an hour and a half. I was able to work. And then I thought, okay, now I need to go to bed. Thought, wait, maybe I need to take more. I took more. Another hour and a half, I was awake and working. And I took what is now 5 doses of this that first day. Okay. Stayed awake the whole day.
Wow.
That was shocking. Yeah. So patients don't have to be as debilitated as I was to enjoy the improvement in the central nervous system, the short-term memory, the brain foggy stuff. All of that was shot. So it all came back, praise God.
Yeah. And can you tell us a little bit about the supplement that you developed and why it helped so much for conditions like this?
Initially, when I was working on this, it was for my son and I. I developed basically complete gastroparesis. I could not have a bowel movement. I went everywhere, even to the emergency room. One doctor sent me to a surgeon trying to figure all this out. And I had to sit down once no one could help me and figure out, is there a way to stimulate this vagus nerve? I was thinking at the time that it was a vagus nerve problem. right? Considering maybe it was compressed at the neck, but I didn't know. So I tested the receptors of the vagus nerve to see. I remembered in class in optometry school, remembering there's two parts to the vagus nerve. And there's the long part that goes from the brain, into the chest and abdomen. And then I remembered the teacher saying, and then there's a small gap or synapse. Then there's a tiny postganglionic vagus nerve. And he said, and I remembered the words, which is almost freakish, saying that the postganglionic vagus nerve is so small, it's almost a part of the organ itself.
Okay.
I thought, okay, if I damage my vagus nerve, if it's compressed at the neck, I should have that postganglionic portion. I've never had abdominal surgery.
Yeah.
Is there a way to stimulate that? And what I did was I used an agonist or replacement for the neurotransmitter. The neurotransmitter is acetylcholine. The agonist or replacement for it is nicotine. And I used a nicotine patch. And it went right onto the receptors in the bowel movement. And it was very repetitive. And I called patients, you want to try something? Our receptors worked great. So nicotine, sadly, is not a replacement for a systemic acetylcholine. Causes other issues like increased inflammation with regular use. And I experienced that at day 4, and I was just on fire, But I got the answer I needed. There's a workable solution. And then I sat in my kitchen and tried to use my organic chemistry knowledge, which again, talk about old, my new work with genetics, as far as I gotten. And I was trying to work through everything I needed to stimulate that receptor, but with an over-the-counter mix of ingredients. And it took a while to get all that right. But that's now released as Parasim Plus, which is life-changing.
Yeah.
Initially, it was really just good for my kids and I. We used it for years. And I had no plans of ever getting in the supplement business, But there was a time I was in the hospital. They gave me an antibiotic that activated inflammation. It was horrible. I almost didn't crawl out of there. But it triggered pancreatitis. And I got home and I thought, is there any way that Parasim Plus could be enough to help with pancreatitis? The pancreas is partially under vagus nerve control. And being an itis, it's a state of inflammation. And then so I started on Parasim Plus again. And honestly, days, and the stool color started to turn brown and it didn't flow anymore. And I thought, oh my God, life-changing. I need to get this out to the world.
Wow.
And to that very difficult journey to do that.
Yeah.
And working through that, I thought, this is all new. I don't think anyone's ever tried to figure out how to stimulate that receptor with an over-the-counter blend. And I patented it. I have now 5 patents. I just kept expanding on it. And I really felt like it was brand new discovery. And it was.
That is awesome. Yeah. And I actually just learned about your Parasim Plus recently at the TFIM lecture. And our first shipment is on its way. So,
I'm excited about that.
Yeah.
But if you think in terms of the patients who are affected, and again, it can be just aging, right? But you look for like a tendency to develop sluggish digestion. Oftentimes it exhibits as if they become constipated, or they like to take something for, constipation. They lean toward fatigue. They lean toward brain foggy. They might miss appointments, whatever, appointment. They're a little bit moody. And the moods kind of go up and down when the vagus nerve is affected. You can see a little more flushing, more sensitivities, slightly larger pupils, tendency to develop dry eyes. And oftentimes patients who are not sick will say, I just need to eat better. I'm just not sleeping right or whatever. They'll find something to blame. And if your chronic inflammation is to the degree it's affecting the autonomic nervous system, this is what we see. And it can immediately be improved. By immediately, it's so great to see this. Like the cognition can be improved like 15 minutes.
Wow.
That's amazing. When we see patients who are dramatically affected and they're talking to they just have trouble staying awake and you can see their eyes are kind of glazy. literally 15, 20 minutes they're sitting up and their eyes have sparkled again. I love that.
Yeah.
We look for a bowel movement. We want to see a bowel movement. And when we see that, we know the vagus nerve is triggered. And then for people who are looking for something objective to reassure them they're headed in the right direction, look at people's eyes.
Yeah. That's amazing. That's amazing. Okay, just to get off to a slightly different topic, but you've explored the role of intracranial pressure in conditions like POTS and connective tissue disorder.
Yes.
So how does that reshape the way we think about brain fog and fatigue?
It changed everything. And this was really the first thing I was able to peel back. So there is a book, and I'm happy to share this book with anyone who wants it, called The Driscoll Theory. And it was put out, it's been, 15 years there. I think it's new, to most people. But I released that there was a propensity for patients to develop high intracranial pressure. And we were missing it because they didn't present as typical, right? As doctors, when we're looking for high intracranial pressure, the first thing we look at is the optic nerve in the eye, and we look for it to be swollen. And in patients, it wasn't truly swollen. And so it just gets blown off. But it responds to treatment right away, which is awesome. And I'm so happy to say, Dr. Ward, this went around the world and it changed everything. And it was amazing to watch it. No one had ever gone to intracranial pressure before. So I got to talk to people all over the world who are benefiting from that. And now there's Facebook groups and stuff. I mean, it is absolutely nice. But I think that's one reason I was meant to be in this position, because I'm an eye doctor.
Yeah.
It's an area we're trained.
Yeah.
However, even as a patient, it was very easy to miss it.
Yeah. So for clinicians who may be listening, what are some of the subtle clues that point to autonomic dysfunction, even when standard testing looks normal?
Yes. We're kind of lucky in PODS, if you want to call it like, in that there's usually objective markers of heart rate. And typically with patients, we don't usually do orthostatic testing. But if there's any suspicion that the parts of the body that should be automatic are not working well, and they do have sluggish digestion, brain fog, dry eyes, etc., you can have them lie down for a few minutes and check their heart rate, and then have them stand up and keep them up for 5 to 10 minutes. They just have to stand very still. When the autonomic nervous system is not working well, unless they're on some medication that changes heart rate shoots up. Yeah. And where we went wrong, or one way we went wrong with PODS, is that there's arbitrary criteria to diagnose that. And the arbitrary criteria includes, like, if the heart rate goes up 30 beats a minute in an adult on a tilt, that's PODS. And I'm like, no. I remember talking to a specialist saying, so if it goes up 29 beats a minute, that's like 28 beats. Yeah. Where I'm going with this. So I say, instead of this arbitrary criteria, why aren't we looking at pattern of illness? And we do see patterns. And in the Driscoll Theory, we kind of laid out some of the patterns. One of them is a tendency to see the heart rate go up when you're vertical, tendency to develop high intracranial pressure, tendency for the inflammation to start to affect vagus nerve, the other, parasympathetic nervous system in the brain. And you see a similar pattern in patients. We don't need to look at artificial criteria.
Yeah. Awesome.
And at least it's objective.
Yes.
The poor people dealing with things that are less objective, like fibromyalgia or whatever, all these sloppy diagnostic criteria, and the patients are just left to flounder with it.
Yeah. So you've studied the vagus nerve function in depth. Where do you think the current conversation around vagus nerve stimulation falls short?
Yeah, and this is tough because I remember, almost 15 years ago, thinking what I see a lot of people do now, and that is we must need to stimulate the vagus nerve. And I remember calling this company in Germany. They were the first company to put out a vagus nerve stimulator that wasn't surgery. And it was in the ear. And I talked to them about, if we're suspecting the nerve is damaged anywhere from the ear on down, am I correct in thinking that vagus nerve stimulation wouldn't be effective? And he said, it's correct. Okay, that could be happening to some patients. It shouldn't make sense. But the bigger question came, and I think it gets overlooked, is that the autonomic nervous system works by itself. You don't have to make your vagus nerve work. That's not your responsibility, right? It happens all by itself. So if it's not working, like mine was clearly not working, something's causing that. And you need to figure that out and fix that. And then step back and say, is this a bigger problem? Is this really a problem with just vagus nerve function? Or is it a bigger problem with the neurotransmitter? And if you think of it as a vagus nerve problem, you'll miss these other systems of the body and you'll still be there. So one thing I did to try to pick that apart, because everything I came across, any theory I was coming up with, I had to prove it to myself and had to think in terms of what every possibility was. And let's rule these out, right? So we sent out symptom checklists. And in these symptom checklists, there were 143 symptoms or something. I tucked in these symptoms of anticholinergic syndrome and sent chronic fatigue, fibromyalgia, POTS, and PTSD patients. And the pattern was classic for anticholinergic syndrome. And it wasn't to the degree of poisoning. It hadn't been poisoned. It would come and go. These symptoms would wax and wane some, but the pattern was there. And there is no blood test for this. You have to recognize it based on presentation. And I recognize patients are so sick. There's so many systems of the body affected. These symptoms were just kind of getting lost in the mix, right? But that was also a huge breakthrough in figuring it out. It's not just a vagus nerve problem. The vagus nerve problem is collateral damage.
Yeah.
And the receptors still work. We could use those receptors. And I still look at the millions of dollars put into looking for an autoimmune condition that's shutting down these receptors. And patients do present like they're autoimmune. And we see more autoimmunity in POTS than the general population. So I understand how they went down this route. But what I don't understand is how they can look so hard for an autoimmune condition affecting the receptors without testing the receptors.
Yeah.
And that's where an individual researcher is able to move so much faster than big, clunky institutions.
Sure.
And I totally respect their work. I respect the scientific method, everything. But I can move fast and be able to test those receptors in a week. I knew, well, we don't need to spend millions of dollars looking for an autoimmune. Those receptors.
Amazing. Yeah.
Can use that knowledge to stimulate those receptors.
Yeah. That's amazing. So how does endothelial health tie into inflammation, autonomic dysfunction, and cognitive performance?
Huge. It's huge. And this is one of those things as I get older too, and I encourage all of our patients, and in fact, I encourage everyone to take care of their vascular endothelium. This is the inner lining of the blood vessels, and blood flows down the blood vessels. And if the flow gets stagnant or the blood vessels get inflamed, inflammatory cells are more likely to stick or more likely to plaque formation, basically develop cardiovascular problems. And the clue I had, again, a million years ago, was looking in the back of the eyes. I could tell in almost 90% of the patients, I could see the vessels were, I could see it. The veins were a little bit too large or the arteries were a little bit too small. And the veins were not always smooth. Usually when we look at veins, the caliber is very smooth. And I could tell it was irregular in many patients. And then the arteries were much more prone to plaque formation. Even in my 9-year-old son, and we don't see that. As eye doctors, when we see plaque formation in the eyes, we sit the patient down and go, okay, we need to check it. Your cholesterol checked, that sort of. And I have a 9-year-old, wow. Why were the patients much more prone to this and what can we do? So all focus there for a while was we need to bring down some of the vascular inflammation, keep the blood vessels working well. It was all about small and medium blood vessel health.
Yeah.
I remember talking to my cardiologist and I was trying to share some of what I was learning with him. Every time I went and saw him, and I said, you save people's lives by helping them with the large blood vessels. You'll stent or, Marfan's tape it or whatever. I said, which is wonderful. But what about the small and medium vessels? And he goes, yeah, nobody cares about that. Yeah. And I said, well, think about it though. Brain health, kidney health,
Yeah.
Well, if someone develops dementia, I'll send them to a neurologist. If someone develops kidney disease, they go to a nephrologist. I said, that's the problem. It's too late at that point. We need to be focused on achieving and maintaining small and medium blood vessel health. And I see patients who are dealing with the tendency to develop vascular dementia, other neurodegenerative conditions. We see a lot of chronic kidney disease. I was in stage 3 chronic kidney failure for 3 years.
Wow.
And figured it out, cracked it in a week. But until then, my doctors were at a loss because we don't focus enough on that.
Yeah.
You need to. But there's not really a doctor that you go to and you go, I want to have my small and medium blood vessels checked. That's not really a thing, right?
Yeah.
So we always look at what is already available. We don't need to invent a new drug or anything. What preferably is over the counter, if not, what low risk medications are available to help with the vascular health. And COVID kind of changed some things because we were harping on this for years. I released the term inflammatory POTS many years ago, and nobody really knew what the heck I was talking about until COVID. And then they could kind of see, oh, it looks like the vasculature is affected.
Yes.
Yeah, and it was, it helped to explain some of these concepts. And then, a year or two after COVID started, the term inflammatory POTS didn't seem so outrageous anymore. It was starting to make some sense to people. So that was very helpful.
So for someone who just doesn't feel like themselves, that they're having low energy, brain fog, poor stress tolerance, what are the earliest signs of dysregulation?
The high intracranial pressure, back up just a little bit, is a secondary problem. It's driven by chronic inflammation. And as eye doctors, we know that. We're usually the first people to diagnose high intracranial pressure. Where we fall down is that the types of chronic inflammation that we're able to measure are so limited, right?
Yeah.
So as eye doctors, I'm embarrassed to say this, but usually an eye doctor, when they find high intracranial pressure, they'll say, oh, you probably just need to lose weight. You're a female, over 40 female. Oh, it's horrible. There are so many other more common inflammatory problems, so we don't measure them well. Really, patients get lost, but we should look for the patterns.
Yeah.
We know some things are inflammatory, like you discussed aging, that's inflammatory. Menopause is inflammatory. Lots of autoimmune conditions. There are certain things that set us up for a surge of inflammation, and if our body genetically can't calm it down, then that inflammation does damage. So for what you had described, I'm like a hammer. Everything looks like a nail to me. I hear somebody's not feeling well. It's like, oh, are you constipated? Depression. And this is odd for like my friend group, because I have friends who are like, oh yeah. And then they respond really well to treatment. And there's some sort of inflammatory thing happening. You don't have to know everything about it to know what you can do to help.
Yeah.
So I think oxidation warrants a mention here. With inflammation, we always get oxidation. And the oxidation further damages the blood vessels, the endothelium, et cetera, ultimately can damage organs. But it also changes the brain chemistry. And this is something we see across the board. And I would really like to help these people. Had I not lived through every one of these symptoms, I would have never believed this. But it causes a change in brain chemistry from there. It causes an increase in anxiety type symptoms. And it can exhibit like anxiety or even panic. But it can also exhibit as almost an OCD, attention to detail, high achievement. We tend to be like in the top 1%, unless we're really sick. And we expect other people to be the same. It's not. And we can use that as a sign of when those symptoms go up. This is not a psychiatric illness. This is an inflammatory illness, very treatable. And by focusing on the oxidation, the oxidation ironically increases inflammation. So again, it's another cycle patients get caught up in. But we always look for those symptoms as a clue that the oxidation is getting worse.
Yeah.
And it does need to be addressed. So hugely important. Hugely important. And pretty much across the board in POTS patients.
Okay.
They're super smart people. Which is awesome. They're so devoted to detail, which I love as would I,
Yeah.
But that change can become negative.
Yeah. Why do you think some patients are unusually sensitive to treatments? And how does that tie back to the autonomic dysfunction?
Yes. As the inflammation goes up, sensitivities go up.
Okay.
I remember early in my illness, the doctor said, well, let's start you on. He was going to start on some acid reducer. I said, well, first I'm going to just have to tape it to my forehead. And if that does well, maybe I'll smell it. If we're still good, I'll lick it. Yeah. He's like, what's he talking about? I said, no, I'm just so sensitive. I'm sensitive to everything. And when we see patients at POTS care, when they're all sensitive, they all say, but I'm more sensitive than you've seen before. I go,
yeah.
So for us, that's a symptom of the inflammation. When you control the inflammation, calm down the effects on the brain, those sensitivities start going away. But again, those sensitivities are driven by the inflammation. The inflammation does affect the autonomic nervous system. So it all ties together. Yeah. And some of the triggers for inflammation, when we talked about viruses, et cetera, another common trigger is stress. It can be psychological stress. It can be physical stress, exposure or something. But oftentimes, and it's so heartbreaking with the young people, I'll see that they've had some sort of trauma and they basically blame the trauma for their illness, which I understand, it triggered the inflammation. But if we control the inflammation, they can recover from that trauma, just like someone else who didn't have a problem recovering from the same trauma. But they're an inflammatory patient. We need to locate and treat them. And then some of these wrongs get righted. And again, I felt so lucky that I was sick before my kids because I would have probably wondered, what was up with them.
Yeah.
It's one of the most heartbreaking things I see at POTS care is people who are basically married to their psych diagnoses, thinking this is just going to be me. I'm going to be anxious, depressed, OCD, whatever. Very sensitive. I can't handle stress. I'm not going to go to college or whatever. They change their whole lives because of sensitivities rather than address the inflammation and then recover from it. And I got so sensitive, I couldn't even make a phone call.
Wow.
That was too traumatic for me.
Yeah.
I couldn't handle a negative thought. And it got so bad that if I just thought of anything, it would flush and start sweating. Like I think, I wonder if the weather's changing. Oh,
wow.
I just wanted to jump the bridge.
Right. Wow. Well, what are a few practical daily strategies that truly help reduce inflammation and restore autonomic balance?
What we want to be careful is not blame the patient for their illness, right? Especially those dramatically. So like I got sick, my nutrition was great. I was in great physical shape. I taught exercise. I didn't need to meditate or whatever. I was sick and correcting that righted all those wrongs. Having said that, you can certainly increase your inflammation by not paying attention to that. So, eating cleanly, and everybody's version of clean is a little bit different. One thing you can do pretty reliably is when you eat a food, watch your heart rate, like 30 minutes later. So if it goes 10 beats a minute, you're likely reacting to that food. And set that aside. You probably can get back to it later, but for now, that's causing you some problems. And then for exercise, again, I told the doctor I was in great shape. Lack of exercise did not make me sick. So I didn't feel how exercise could make me well, right? But eventually you're sick for years, as I was, then you get deconditioned. And cardiovascular system is very sensitive to that, where we're dealing with endothelial damage. And if you stop that flow of blood, when it goes rapidly down the endothelium, it strokes it, if you will, releases nitric oxide. It's great for the vasculature. So you do have to get back to something that increases circulation. Walking is great to do that.
Yeah.
But I have been there where there is no possible way I could get that.
Yeah.
You've got to address the other problems first. And when we do have the sympathetic nervous system activated, it worsens our inflammation. So somehow you have to stay in your happy place.
Yeah. Yeah.
Because when you trigger with whatever sort of stress you're exposed to, you go south. Later, when that inflammation's better, you can be exposed to all kinds of stress and you don't have the same reaction.
Right.
But while you're going through recovery, protecting yourself from some things that trigger that inflammation can be helpful.
Yeah. Well, looking ahead, how do you see our understanding of the autonomic nervous system evolving over the next decade?
Oh, I'm excited about this. I really am. What I really want to do is the autonomic nervous system. I'm releasing information about how to improve things. Yeah. And that'll be great. And it takes me home, where I started, which is great. I've got this great optometric education, which gave me answers for this extraordinarily complex autonomic problem. And I owe optometry for it. Very grateful. So plan to release that. But my goal in some of this autonomic problem is to show that genetically, most patients are sick. That if we can rename these conditions based on objective genetics and say, okay, you've got this tendency. So if this takes off running, this will be high in the blood. Oh, there it is, It ties it all together. We throw out the invisible illness label. We get rid of the chronic fatigue or fibromyalgia or whatever. And patients are labeled based on their genetic tendency with markers that are objective in the blood. And then we have treatment protocols for those, and the labels are different, right? So that's really what I want to do. Figuring out how inflammation affected the autonomic nervous system is huge, but it's very important that we ultimately give patients objectivity they need to get the validation for their own illness.
Yeah, absolutely. Okay, finally, what is one belief about aging or cognitive decline that you think we need to completely rethink?
I think it gets back to, that's a normal change, right? Yeah. So I don't think so. We see so much cognitive decline from either the intracranial pressure getting high, the neurotransmitters getting low, or the vascular disease, that if we focused on those, how many of these neurodegenerative, illnesses could we get rid of?
Yeah.
It would be awesome.
Yeah.
Cannot tell you how often we will look at a brain MRI and I'll see the small vessels. I go, oh, we are all over vascular health for you.
Yeah.
And their doctors never mentioned it.
Yeah.
I think it's objective. You can see it. You know where this patient is headed, right? Yeah. Extraordinarily proactive. I just don't think they have enough tools in their toolbox to help with it.
Yeah.
So there isn't enough focus on it.
Yeah, absolutely.
That is changing.
Cool. Well, thank you so much for joining me on The Functional Edge.
Thank you.
And I hope to everyone that today's episode gave you fresh insights and practical tools to level up your life. If you found value in this conversation, I'd love for you to hit subscribe, share it with someone who might benefit, and leave a review. It truly helps us reach more people and continue to be bringing meaningful root cause health insights to those who need it the most. So for more resources, updates, and behind-the-scenes content, visit drjuliaward.com. And Dr. Driscoll, how would people get in touch with you and find your product as well?
Yeah, I'm at POTS Care.
Okay.
We have a Patreon account now called POTS Rebels, which has been great. And we meet regularly and I share all my information with them. And the products based on those patents are at Vagus Nerve Support.
Okay. So potscare.com and vagusnervesupport.com. We'll definitely put those in the show notes.
Yeah, appreciate it.
Awesome.
Thank you for all your work and for sharing information with so many people. You can help every day. It's wonderful. Thank you.
Thank you. All right. Until next time, stay strong, stay healthy, and keep living on the functional edge. Thank you for joining me on The Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the functional edge.